Okay, so our presentation is on pronator syndrome. So pronator syndrome is also called pronator teres syndrome, and it's entrapment of the median nerve as it passes near the elbow, specifically when it passes between the two heads of the pronator teres muscle or under the proximal edge of the flexor digitorum superficialis arch.
So for clinical presentation, it presents as a kind of like aching pain in the forearm or like tingling in the ventral thumb and index fingers, like along like the median nerve distribution, because it is a median nerve entrapment. You can also have like numbness in the hand, like weakness in the thumb and index finger, and potential weakness of the forearm muscles, just because it's impacting the muscles that are innervated by median nerve, and it impacts the amount of muscle weakness is variable and depends on the severity. But it can also have medial elbow tenderness.
Okay, so like many hand-based diagnoses, they can be often confused with carpal tunnel syndrome. So the differences between carpal tunnel and pronator teres syndrome. In pronator syndrome, there isn't going to be an increase in symptoms at night. There is going to be the addition of forearm-based pain. They'll have a negative Tinel's test at the carpal tunnel, and their symptoms are not provoked during wrist flexion.
So for patient evaluation, there are a couple of different like provocative tests that an OT can do. And the different provocative tests will test like the different like areas where the entrapment could occur. So the first one is to like apply resistance to the long finger or like middle finger to test like if it's at the arch of the flexor digitorum superficialis. And if when you're applying resistance to the long finger, if there's increased symptoms, it indicates that it is at that site. The next provocative test is to apply resistance during elbow flexion with the forearm insupination. And then increased symptoms indicate that the site of compression is at the bicipital neurosis. And then the next one is you apply resistance during forearm pronation with the elbow extended. And increased symptoms indicate that the site of compression is at the two heads of the pronator teres, and it's important to figure out like where the compression is occurring because it will impact like treatment for pronator syndrome. And the picture does show the different ways or like the different provocative tests and like where you can like place your hands to do the provocative test. Another provocative test is the Tinel's test at the proximal anterior forearm, and a positive one does show signs of pronator syndrome, but again, you don't want to do it at the carpal tunnel because that will, if there's a positive one, it indicates carpal tunnel syndrome, not pronator syndrome. Other tests are the EMG and NCV. You can get those done to test if it is pronator syndrome. Other things an OT can look at is sensory changes. Since it is median nerve entrapment, you'd want to see sensory changes along like the median nerve distribution. So like along the volar radial 3.5 digits.
So as for treatments, they also kind of vary depending on where the entrapment is occurring, especially when it comes to the orthoses. So a forearm-based orthosis with the hand included could be a possible treatment for pronator syndrome if the compression is at the fibrous arch. However, if the compression is at the pronator teres, then a long arm orthosis with the forearm in neutral, the wrist in neutral, and the elbow in about 90 degrees of flexion would be used instead, because the long arm orthosis is going to prevent pronation and supination, which could provoke or irritate the median nerve. Myofascial release can also be a helpful treatment, as it's going to release some of the pressure that the soft tissue, the muscle is, the muscle is putting on the median nerve. Home exercise programs can also be a very useful treatment, including median nerve glides or gentle stretching of the pronator and wrist flexor stretches. And patient education to avoid gym exercise leading to pronator teres hypertrophy is also very important, as well as patient education on better ergonomics at their desk, including use of a split keyboard or a vertical mouse, could also, to reduce pronation, would also be a very useful treatment in pronator teres syndrome. And these are our references, and thank you for listening.